Welcome to Harmony Talk, a podcast that focuses on people who have accomplished a dream. Dreamers who become doers, sometimes against great odds. Our guests hail from all walks of life: science, industry, the arts, sports, and social impact, to name a few. This podcast is brought to you by A.M. Skyer, a third-generation family insurance business started in 1920. I'm your host, Lisa Champeau. For this episode, we're taking a slightly different tack. We're zooming in on a dream project with a unique goal that became a reality in the early 2000s, the Geisinger Commonwealth School of Medicine in Scranton, Pennsylvania, and how its current dean and president, Julie Byerley, MD, is helping to keep that dream alive and on course. Dr. Byerley, who has a master's in public health in addition to her medical degree from Duke University, is also executive vice president and chief academic officer for all of Geisinger's educational programs, under the umbrella the Geisinger College of Health Sciences. This includes the medical school, Geisinger School of Nursing, School of Graduate Education, its Academy of Educators, and training programs for fellows and other learners. Dr. Byerley also oversees the Powerhouse Research Institute at Geisinger. In short, a lot of responsibility. Thank you for being with us, Dr. Byerley. I'm very grateful after reading all that. You are very, very busy. Thank you for being with us.
Well, thank you so much. Thank you for the opportunity. I really appreciate it.
Well, I'd like to start with the medical school. When it was formed, its founders had a dream, a unique vision focused on caring for people in the, quote, context of their lives and their community, kind of community service with a mission. They also wanted their students to come back and practice in the area. Can you elaborate on that mission? Can you explain it, kind of?
Yes, the founding story for our medical school is so inspirational, and it is one that allows us to invite young people into fulfilling the dreams of our founders. Essentially, there were a small group of community members who decided to do something about the fact that central Pennsylvania and northeastern Pennsylvania did not have enough physicians. And they determined that the best way to address that problem was to create a medical school. And that is a very unusual way for a medical school to be founded. Typically, a big university will decide to add a medical school, or perhaps a health system decide to add a medical school. But for community members to come together and start a school from scratch is incredibly unusual. And it was a dream they had together and a dream that they fulfilled that I have the privilege of helping to live out into reality today.
Which is terrific. And part of that was they wanted the students to be trained kind of in community service. How do you do that on a day-to-day basis with medical students who have to learn biochemistry and so on and so forth?
Sure. So we know from the literature in medicine that the way you create physicians to serve needed communities is that you educate a cohort from that community. You pick people who grew up in the area and you prepare them well to serve that area. In doing so, you educate them in community engaged ways. That means that as they're learning, they're becoming part of the community, getting to know their neighbors in the community, learning about the health issues in that community, and meanwhile growing roots so that they feel engaged and involved in the community and willing to stay. So from the beginning of our medical school, the founders thought it was really important to get our medical students involved with nonprofits that are doing service work in the area, and we continue to do that. They wanted our students from the beginning to learn from real community members that served as standardized patients and teachers, and we're still doing that. We do it in all kinds of ways that help our students really recognize and know the community members that they'll be serving once they're independent physicians.
Well, I read somewhere that there are actually families in the area who allow these students to follow them. So how does that work?
So our families in the community volunteer to participate with our students, and they'll share their stories. Every family has a health journey to share. The particular families that teach our first-year medical students often have someone who's experienced a significant illness or some sort of chronic and ongoing interaction with the health system. For example, they might have a child with special needs. And our community member volunteers connect with some of our staff. Our staff matches up our students in small groups with these families, and they have ongoing relationships where they share not only the story of their family, but the story of that family's interaction with the healthcare system. And we hope and believe that our students understanding the family perspective will make them better doctors in the end.
Absolutely. I mean, just to understand, as you said, in the context of their lives, whether it's a child with special needs or perhaps they have a transportation issue, that's really important.
Well, just yesterday, I was walking down the street in downtown Scranton and I ran into one of our first year medical students, and he was carrying a overloaded grocery bag and he was beaming, his smile so big. He told me that he had just had a meeting with his family, the patient family that he's supposed to be learning from. And in addition to sharing their story, they also had loaded him up with a homemade dinner, which was really a sweet story of connection where these families not only serve our students by educating them, but they also help them build ties to the community and feel supported.
And it goes both ways then. That sounds terrific.
Absolutely.
Now, the medical school, of course, was not part of Geisinger in the first place. That didn't occur until 2017, 8 years after its first class. How does Geisinger keep that mission going?
Well, Geisinger has an inspiring founding story as well. The story of Geisinger's founding occurred 100 years actually before this founding of what was first the Commonwealth Medical College, now Geisinger Commonwealth School of Medicine. So Abigail Geisinger was a widow living in Danville, Pennsylvania. She had multiple resources, including specifically a car and some wealth. And what she was called to do with her car was drive people who were in need of medical care to seek care in towns that had hospitals and other healthcare clinics. She could have done just that, just drive needy patients to seek medical care. But instead, she decided to solve a problem for her community. And she went and found a physician. Henry Foss was his name. And she brought Harold Foss to Danville to start the hospital that first was Geisinger, now is Geisinger Health System, an integrated care delivery model that includes a health plan, our medical school, and 25,000 employees. It's really an amazing story to realize that Abigail Geisinger did that even before women had the right to vote. So even though Abigail Geisinger did not know the founders of our medical school, the dream stories are inspirational and parallel in my mind. Abigail decided to use her resources, look upstream, solve the problem, and bring healthcare to a small community. The founders of our medical school used their resources, their connections, garnered support from city, state, and federal levels and philanthropists, and built a medical school to look upstream, solve the problem of bringing doctors to our community. So, yes, the medical school and Geisinger were not related from the beginning, but I think it was destiny that those two dreams came together.
It sounds like it. They sound very much aligned. Of course, I don't want to get too far afield, but Geisinger, of course, was kind of bought by Kaiser Permanente and Ryzen Health, which is a nonprofit system started by Ryzen. Are they also going along with this mission?
Absolutely. So, on multiple levels. For example, Risent is a new nonprofit that brings together health systems that are interested in advancing value, improving quality, and at least keeping costs under control, maybe even decreasing costs to the public, costs to the insurers in a nonprofit way. So, Risent brings with it Kaiser Permanente's commitment to community service and community impact. And there are all kinds of examples of how Kaiser in the communities where it's been in practice is making a difference through the community. One of those ways happens to be that Kaiser has a med school of its own in California that provides an education for future physicians also in community engaged ways. So we do have a lot in common that we strive to improve the health and well-being of the communities that we serve. And I think very importantly, through Risent, Kaiser is continuing to allow Geisinger to have a local community focus. We're working together to solve national problems, but deliver those solutions at the local level.
Your background, we're just going to talk about you for a minute, seems to fit right into what you're doing. You have a history of shepherding students and creating opportunities for them. In fact, and I'm going to have to read this because you've been honored with so many awards, I'm only going to mention a few. The American Academy of Pediatrics honored you with 2 Special Achievement Awards, one for, quote, successfully nurturing medical student interest in pediatric careers, and the other for your work in organizing chapter interest groups for young physicians and medical students. Both of these, I believe, while you were at the University of North Carolina, where you eventually became the Dean of Education. Was teaching in academia part of your dream as opposed to working in, say, a clinic?
Thank you. Yes. When I was a child, I had an interest in math and science, and it was less common for girls to be encouraged into math and science at that time in the 70s. And I got encouraged into math and science and enjoyed studying those things. And then my dream became that I wanted to inspire other young women into math and science and young people in general into math and science. And so, right out of college, I actually became a high school teacher. And I was very excited to get ninth graders who I was trying to teach to consider themselves pursuing a career in science. And I was particularly inclined to inspire young women to do that. That was at the time that HIV was just being recognized, and we understood the connection of HIV to AIDS. And at that time, I certainly was part of the community that was very scared about what might happen to all of us, but in particular, our young people with regard to HIV. And that concern about HIV and the health and well being of young people actually led me to pivot in my career and go to medical school. So during medical school, I got very interested in teenagers and young people, and that led me to a career in pediatrics. And as I was working in pediatrics, I found opportunities to blend the dreams of working with young people and improving the health and well being of young people in pediatric education. So, yes, the early parts of my career were in practicing pediatrics and in pediatric education.
Yeah, that was a scary time, the HIV crisis. And HIV, it's been somewhat controlled, but it hasn't gone away, that's for sure.
It's a science success story for sure, how HIV is now a chronic illness that people can live very well with, when not very long ago we had thought that people would die from that disease.
So you decided to go to medical school and pursue that line. But again, you kind of steered towards academia.
I just love watching young people learn the same things that I love about caring for children, seeing someone in the present, but envisioning their future as a healthy, contributing adult. That's the same joy that I get from watching or participating in education. You see someone enthusiastic, eager to learn, and then you can envision their future contributing with their skills to improve the health and well being of others. It's a very similar process.
You also have a pretty big vision, as I understand it. When you were at UNC, you sought and received a nearly $4 million federal grant to launch a primary care pediatrics residency program. Now, this is distinct from a general pediatrics residency. What is the difference?
Well, we need more primary care providers all throughout our country. And I believe that the best way to create primary care providers is to specifically train them to provide high value care, full scope primary care. And we've done that in a variety of ways, both in North Carolina, and now we're doing that in Pennsylvania through Geisinger. What we're doing is thinking about, what does the primary care clinician really need to be good at, know, and be able to do. And we make sure that we prepare them for that specifically.
So a general pediatrics residency would be slightly different in that they might be headed towards a specialty.
You've got it. Yes, we do need pediatric subspecialists for sure. So I do hope that some pediatricians pursue subspecialty. But I want our primary care docs, be they caring for children or adults, to really have a special skill set that helps them prevent illness, treat illness early, recognize it early, and provide care that is of highest value, meaning really high quality at the lowest cost. We know that as illness develops and progresses, it not only burdens the patient to a greater extent, but it also burdens our health system to a greater extent with increased costs, the need for more and more procedures, the need for more and more medication. If we can work upstream, keeping people well or recognizing and managing disease early, that's to everyone's benefit.
Geisinger students, as I understand it, are required to pursue research projects in quality improvement and community health. So in 2021, the medical school launched the Total Health Curriculum, which sounds great. Could you explain that a little bit?
Sure. Total health implies that not only does the physician of the future or today need to know the basic science and clinical science of doctoring, of course they do, but they also need to understand how the systems work to support health and well being. That's not only the health system, they need to know those pieces like how to work with interprofessional team, what's the appropriate role of a pharmacist, a social worker, a nurse, etc., and how do we optimize care delivery in teams. But also, they need to understand how the social drivers of health influence an individual or a family. And so we teach our students from early on to think about the social determinants of health, to think about the family and community settings that our patients live and work in, and to think about how to leverage the resources of the community and the family to optimize the health of the people that we serve.
You have a master's in public health. How has that informed your career and what you're doing? Sounds like a lot, if you don't mind my saying.
Yes. Well, in public health study, I had the opportunity to learn more information about data and what data means and, understanding epidemiology and that kind of thing. And I think that skill is so important today and will be even more important in the future. So I appreciate that. But also, the public health perspective helps you think at the population level. Understanding disease management is really, really important in protecting the health and well being of children. But getting children in appropriate car seats and getting all of us wearing seatbelts saves a lot more lives than directing attention at a single particular disease.
Now, the other half of that dream that the founders had, and that I believe you're still trying to pursue, is to keep some of the students here in northeastern and central Pennsylvania. You just had match day for your 2024 class. Congratulations, everybody matched. How is that working out in terms of the students staying nearby?
Yes. Well, we're still a young school, and over half of our graduates are still in training. But we've graduated 1,000 new doctors. That's very exciting. And of those 1,000, about 400 or so are independently practicing, and a third of those are practicing in Pennsylvania. That was our intent. That number will continue to grow because we're making investments in that. We have an amazing loan forgiveness program that our medical students who agree to go into fields that we need at Geisinger in our Geisinger footprint in northeastern and central Pennsylvania. If they return and take a job at Geisinger, then their tuition is forgiven. They will not have debt for their tuition. They also, if they sign up at the start of their med school, will receive a living stipend to cover a lot of their expenses of having an apartment and eating and that kind of thing so that they can focus on school. We call that cohort the Abigail Scholars in honor of Abigail Geisinger, the founder of the health system. And it's a huge and transformative investment that Geisinger Health System is making in the future physician workforce for our region.
Is that something you initiated, or was that already in place?
It was brewing before I got here. It, in fact, was one of the things that I was so excited to come join the Geisinger team about, because I believe that when we invest in our learners becoming our colleagues, that we embrace education at a whole different level. If you're teaching someone to do something because they're going to go to some other part of the country or world and do it, then sure, you hope they learn well, but you're not dependent on the outcomes of their learning. When we are educating people that we will soon work with, or even more dramatically, people who will soon become our doctors, we really care about how well we do that work. And I find the idea of taking 40 of our students in each of our classes and knowing that they will become our doctors really provides an investment in knowing that we have to educate them well.
Well, those are wonderful incentives for sure. I know that a lot of students, medical students, when they go into their residency programs is kind of often where they stay. They stay in that state or that town. It's where they find perhaps their spouses and so on. So, what are some of the other challenges faced by Geisinger in maintaining the mission?
Well, we don't often study the piece that you just referenced, where people find their partners and spouses for life. But if we could snap our fingers and add one thing to what we do, it would be that we would help our young physicians develop relationships in the community that keep them in the community. And that really matters a lot. Having them from the area so that they can see themselves living in the area long term, educating them in ways that they understand the community and are best prepared to serve the community, and then putting them with cohorts of other people that are excited about doing the same thing, whether that be directly in their profession or in their social lives. That really helps. So we participate actively at Geisinger in the economic development of the region, trying to recruit businesses to open up shop here, trying to recruit opportunities for transportation, childcare, excellent schools, that kind of thing, because the community well-being really helps to attract a workforce that is of high quality and can serve us well.
Let's talk for a second about the other schools under your wing. How do they all relate to the medical school? Do they relate? Do they have the same mission?
Yes, we do have the same mission of serving our community and improving the health and well being of our community. So, for example, we are educating young nurses and older nurses that are coming from other careers in our nursing school that is housed in Lewistown, Pennsylvania, which is a good ways away from Scranton, Pennsylvania, where the medical school building is. That's an area where Geisinger previously offered a diploma program in nursing. We added a little more structure to that program and brought it to a degree granting program, an associate's degree program, under the umbrella of our College of Health Sciences so that we can streamline resources and develop interprofessional teams to learn together. So we have medical students and nursing students learning together in simulation centers in Lewistown and at the bedside of the hospital rooms in our Lewistown hospital. We need nurses. The world needs nurses. And we're educating not only the ones through our nursing school, but also our partner schools in the region often send their nursing students to rotate in our clinical facilities. And we're very happy to work with them as well.
Do you find that we do need nurses? Is it difficult filling the class, or do we have a good, strong student body?
We have a good, strong student body, I'm thrilled to say. The crazy thing about needing to boost the healthcare workforce is that people want to work in the health profession. So we actually are not able to admit all the applicants to nursing school, to medical school, and to other health profession schools in our country. And that's a shame. We really need to build capacity in our classes so that people who want to go into these needed professions can do so. And we're doing that as fast as we can in our medical school. We started with our first class in 2013 of just 65 students, and now we're up to 126 students that we enroll each year. On the nursing school, we started with a little class of less than 20 students, and we already have doubled that. We'll grow it as fast as we can. But all over the country, we really need to be educating health professionals and increasing our class sizes.
Absolutely. So tell me for a second about the Research Institute. I don't think a lot of people do know about the Geisinger Research Institute, although they've certainly done a lot of, I think, some groundbreaking work in DNA or other fields, genetics, et cetera.
Yes, we have a long history of successful research at Geisinger, but what we're probably most famous for is our work in genetics. We have partnered with industry and run a project that has over 300,000 of our patients who have agreed to have their DNA sequence looked at. That's called whole exome sequencing. And then, of course, de identified from their name, but paired up with their medical records so that we can look at inconsistencies or irregularities in the genetic code and compare it to diseases or illnesses that are brewing. We also are sort of flipping that perspective and looking at people who are healthy and well, and what can we learn from the genes of people, for example, that are living to be 100 years old, what's special about their genetic makeup, that kind of thing. So we're not only looking to recognize disease, but we're also looking to accentuate wellness by looking at the genes of our patients.
I know this is an audio podcast, but I must say, since I can see you, you got very excited talking about that, about the research going on there. And hopefully some good things will come out of it for the future.
Absolutely. I'll just tell you one story that is amazing about the power of looking at genes attached to medical records. At Geisinger, we take care of all kinds of patients that have all kinds of problems. One of the things that we do very well is bariatric surgery. And as we are caring for patients that get bariatric surgery, we get a liver biopsy on all of those patients. Now, no one gets bariatric surgery if they do not have obesity. So, all of the patients have obesity, we know, and usually obesity causes damage to the liver. Well, our scientists, our clinical researchers noticed that a chunk of patients, about 20%, about 1 in 5 of these patients that were obese enough to need bariatric surgery, had a healthy liver. How did they still have a healthy liver? We were able to look at that cohort that has a healthy liver, look at their genes, find a gene that was determined to be protective of that liver. And now a drug company we're working with in partnership is trying to make a medicine that will replicate what that gene does. What that could mean, if this medicine is successful, is that the 80% of the rest of us that don't have that protective gene could have a medicine to protect our liver's health. That's really exciting work, and it only happens when you have large scale research projects. And we're really excited to have that at Geisinger.
Well, we're almost at the end here, and I just was going to ask you about the future, and that pretty much is the future. But what about the future of the medical school and the future of, let's say, medical students in general? I mean, do you see a bright future, or is it just getting harder and more challenging?
Well, both, of course. Yes, there's a bright future. You cannot meet these young people that want to improve the health and well being of people and populations and not be inspired. When you see students like the ones that I saw yesterday who are telling me about their family partners that are helping to educate them, you can't think for a moment that the world's not going to be a better place as these young people take care of patients. But at the same time, we need support to do that. We need support for science. We need support for education. It takes community investment at whatever level, philanthropists, government investment, et cetera, to really produce the workforce that we need. So I am cautiously optimistic, very optimistic about the individuals, but want to make sure that all your listeners hear a demand that we've got to have help as we accomplish our dreams.
You know, you've had a lot of wonderful stories. Do you have a story about a medical student who went off and did a residency, say in Oregon, but came back to Northeast Pennsylvania because of his or her experience at Geisinger? I know I'm pressing you here, but I know you have a lot of good stories.
We do have a lot of good stories, and we've got a lot. But our first year class, the class of 2013, the first 65 doctors that we graduated, we actually have several back here already practicing either at Geisinger or at other clinics in the region. Two that come to mind. One is Matt Mullen. He is a cardiac surgeon. He's employed by Geisinger. He did his training elsewhere, a lot of it at the University of Virginia, and then was able to be recruited back to this area working for us to improve the health and well being of the people who educated him along the way in med school. Similarly, I think of his classmate, Tom Torilla. Tom went to the University of Scranton, then came to our medical school. He's got an inspirational story himself of unfortunate illnesses that his parents experienced that led him to use his talents in medicine. And now he's a radiation oncologist in Rock, serving the community of Northeast Pennsylvania with his specialized skills in cancer care. We got all kinds of primary care docs working in the Geisinger footprint and elsewhere. And our very first Abigail Scholar is starting his job in primary care this July. So we're super excited about watching the snowball effect that's going to be occurring of our graduates as they finish training, coming back to the community and taking care of the people who inspired them along the way.
That's wonderful, wonderful stories. Well, thank you so much for being with us. Would you like to have a parting word? Anything you'd like to say potential medical students out there?
Yes, thank you. So, Lisa, your show is all about dreams coming true. And the greatest thing for me to get to watch is the dream of a young person who wants to be a doctor. I love to watch that dream coming true as they come through our pre med inspirational programs like Reach High and other programs that we get high school students involved in or college students involved in. Their dreams come true as they pursue their education. But as their dreams are coming true, the dreams of our founders are also coming true because our founders wanted to make doctors like those young people to serve the people and populations of northeastern and central Pennsylvania. Our collective dreams pointed in the same direction, the dreams of young people and the dreams of the founders. And it's so much fun to get to watch.
Thank you very much for being with us and all those wonderful inspirational stories, Dr. Byerley. I really appreciate it. Thank you for taking the time. And I wish you the best of luck with your future students in all the schools and the Research Institute as well. Look forward to that liver medicine maybe one day. Thank you again for being with us.
Thank you so much for the opportunity and all that you do to inspire us all. Thank you.
Harmony Talk is brought to you by AM Sky, a third-generation family insurance business started in 1920. For more on Dr. Byerley and Geisinger Health System, visit geisinger.edu. Talk to you next time.